I love that with research we have the opportunity to change health outcomes for everybody. With everything that we do, whether it be a clinical trial, whether it's something that's done in a laboratory, that publication and how it is used and translated into the health system has a tangible impact on people. And that, for me, the drive and the ability to take that research and then implement it, change the way we deliver healthcare. My job is to change your life and change your health outcomes. And that's what I love. Ramsay Hospital Research Foundation was founded in 2017 and exists to fund research that improves patient outcomes. Over the past 6 years, we've provided over $25 million in research grants to support research that improves patient outcomes and ultimately changes their lives. Importantly, with the work the Foundation has done, we've also completed research projects and are now actively looking at how we translate that research into Ramsay Healthcare to improve our health services and our healthcare delivery. This ultimately will impact every patient in Ramsay and will improve their lives and their outcomes.
Our role in coordinating and running and measuring the outcomes of clinical trials is vitally important for our clinical trials unit. It's grounded in research, it's grounded in evidence, and it's grounded in the best outcomes for the patients. So I think it's really exciting building what we already have, but understanding what the possibilities of the future looks like for our patients, and I think that's really exciting.
Clinical trials in Ramsay are really important for Ramsay because it has a major advantage for our patients, and we know that patients who are enrolled in clinical trials, whether they're on the active arm or the control arm, actually do better than if you're not engaged in a clinical trial at all. And patients that are looked after in units where there is a clinical trials do better even if there's not a clinical trial in their particular disease.
It absolutely raises the profile of the professionalism of nursing, the role that they play in patient care and the integral role they play in the development of best practice for our patients and patient management. And we see incredible benefit that our patients receive as recipients of that outcome of that research, that translation to clinical practice, having access to the best drugs, the best treatment, the most up-to-date evidence-based care. And that's only possible through research, through outcomes of clinical trials, through outcomes of our participation in clinical registries, and all of that improves patient care.
Ramsay Hospital Research Foundation aims to extend our impact beyond the contribution to academic research. We aim to conduct research that makes a significant contribution to the economy and to society by tackling pressing health issues across diverse communities. By fostering partnerships with public healthcare institutions and committing to addressing the social determinants of health, our research aims to improve patient outcomes and drive advancements in the broader healthcare landscape.
So my vision is that in the end, Ramsay for Australia needs to take on that same role of using the fact that we have a large geographic footprint, have a broad range of clinical services, and have the capacity to undertake clinical trials, and we need to grow that. And we need to therefore pull our weight within the Australian hospital networks to give our staff the opportunity to undertake clinical trials and our patients the benefit of being enrolled in them.
Our focus is people caring for people, and I think research plays an incredibly vital part in delivering that best practice to our patients.
We have funded research from cradle to grave, and we look forward to continuing to fund and develop high quality research that improves patient outcomes.